On the Upfront segment, Dr. Anthony Fauci, the nation's leading infectious disease expert. As Michigan's COVID cases surge once again, we're pleased to have Dr. Fauci with us to discuss the challenges that remain in beating the virus. Dr. Fauci, we appreciate your time.
Good to be with you. Thank you for having me.
Well, let's begin with our surge. Michigan leads the nation in cases per capita right now. We had over 6,300 confirmed cases yesterday, a positivity rate of over 15%. When you hear those numbers, how concerning is that to you?
Well, it is of considerable concern because, not only Michigan, but if you look at the nation in general, and Michigan is really sort of representative of that. We had a very high peak over the winter, then it started coming down, and then we plateaued at a really unacceptably high level, which is a real risk factor that you can then have another surge. And unfortunately, this is what's going on in Michigan. This is what we're seeing. And this is something that could happen in other places besides Michigan. So I don't think we could just necessarily point out Michigan. It's a risk anywhere when you pull back on mitigation methods. You know, one of the things that we need to appreciate is that we have some really good tools in our toolkit right now, and those are vaccines. Every day we vaccinate 3 million more people in this country. There are about 50 million people who are fully vaccinated and over 90 million people who've had at least one vaccine. And that is, a matter of fact, a good place to be, because if we could continue that, I believe we'll be able to blunt these surges. And that's the reason why we're of concern that we really want people to not declare victory prematurely and pull back on masking and pull back on avoiding congregate settings, because there's the danger of exactly what's happening in Michigan right now.
And just today, the Michigan Department of Health was informed of our first confirmed case of the P1 or Brazil variant. As of yesterday, we also have more than 1,400 cases of the B117 variant. What's the danger with these variants?
Well, the variants have a number of characteristics that are of concern. Some of them, like the 117 and very likely the P1, have the capability of spreading more readily from person to person, which could explain in part and maybe largely the reason why you're seeing that surge in Michigan.
Now, initially, it was a race to develop a vaccine. As vaccine supplies grow by the week, are we now in a race between infections and vaccinations?
Absolutely. You said it quite correctly. That's just the situation. The more people we get vaccinated on a daily basis, the better we are in preventing a real big surge. So it is sort of a risk. You know, we just announced this morning the community core of getting people who are trusted messengers in the community to help to get people to understand the importance of why they need to get vaccinated when vaccine becomes available. But you're absolutely correct. It is a race between getting people vaccinating and preventing the surge of cases.
Governor Gretchen Whitmer, our governor, was under a great deal of pressure to increase capacity at restaurants and to send kids back to school. She did that. Our numbers now are soaring, as we've mentioned. Did we open up too quickly?
You know, that's very likely the case. I hesitate to criticize anything the governor did because she's really quite a good governor. But I think the idea of pulling back prematurely under pressure, it's understandable why you might want to do that, but the results, I think, are being manifested in what you're seeing in Michigan.
It's also spring break time for schools here. Many students and their families are traveling, which will likely add to outbreaks we've seen in our schools here in Michigan. Does it trouble you that so many people are traveling right now?
Well, we know, and the director of the CDC, Dr. Walensky, has said many times that travel is yet again another risk factor for a surge. Whenever you have travel, it isn't just being on a plane that's the problem. It's the congregating at the airport, in lines to board, in the restaurants and food courts in the airport that bring people together in a congregate setting that is a risk for spreading infection.
To that point, today is opening day for the Detroit Tigers. 8,200 fans are at Comerica Park, an outdoor stadium. That's 20% of capacity allowed for the game today. Should that gathering even be happening in your view?
Well, I think being an outside sport, and if they space them correctly, and 20% is a good number, and people wear masks, I think that would be a minimal risk. So I don't see too much of a problem if you have somewhat of a prudent approach where you don't allow completely packed stadium, but a 20% capacity and have people wear masks, I think would be okay.
And they're going to try to track that and see in terms of making decisions for moving over. But what about restaurants? What about schools? I mean, if you had a recommendation to make to the governor seeing this surge,
right,
would you suggest more restrictions?
I have more of a concern about indoor dining and opening bars than I do about schools. I think we should do everything we possibly can to get the children back to school and to keep them in school. But we know that if you look at the risk of infection, closed door situations with restaurants, particularly if you put them at full capacity, and bars are a problem.
Interesting to hear Dr. Fauci saying that the risk is very likely that we are seeing a surge in cases here in Michigan and that travel continues to be a risk for spreading the virus. Stay with us. Our one-on-one conversation with Dr. Anthony Fauci continues in just a moment. Right now, our conversation continues with Dr. Anthony Fauci, Chief Medical Advisor to President Biden. We're discussing the surge in COVID-19 cases right here in Michigan, digging into the past and looking to the future. Dave Llewellyn picks up where we left off in tonight's edition of 7 Up Front.
We had protests in Michigan, as you well know, over lockdowns last April, threats against the governor. How concerned are you that the fear of retaliation may have some of our leaders hesitant to perhaps impose COVID restrictions, even if they think they're necessary?
Well, I think that's a real danger. I mean, obviously there are threats, both physical threats, as it were, against your governor, as well as threats of not supporting a politician any longer. So there is indeed pressure to do that. Unfortunately, that should not happen because we're going to get out of this. This is going to end. And the better we do in implementing those types of measures, the quicker we will put this behind us. Doing these kinds of things only stall or delay the resolution of this problem.
And to that end, from the very beginning, the virus and steps to confront it have been politicized by some, and frankly, it is still happening in areas. How frustrating has that been for you?
Really quite frustrating, because when you're dealing with public health, there really is no place for politicization. I mean, we've seen that over the last year. I mean, wearing a mask or not has become a political statement. Being able to go to an indoor place where it's crowded has been a political statement. That is really unfortunate, but unfortunately that's happening.
We've learned a lot in the past year about this virus and what we can do and should do. Some of the steps you've mentioned again here today to protect ourselves. There have been plenty of pivots along the way as well. Can you speak to the challenge and difficulty of trying to get everything right as a virus like this rages?
Well, it's not easy. It's been a learning process right from the very beginning. When we got hit hard in the beginning of 2020, there were things about this virus that we did not fully appreciate. But as we learned more and more about it, it helped to shape our policies and our public health policies. So some people may think that that was changing one's tune, but it wasn't. It was really learning more and more about the virus, particularly its ability to spread from person to person when people have no symptoms at all. That's one of the most challenging aspects of this. Namely, 50% of all the transmissions occur from someone who has no symptoms at all.
A couple of other questions for you. Detroit has been one of the nation's most aggressive cities when it comes to vaccination of residents, but we have one of the lowest rates of vaccination. Less than 19% of the city has received at least one dose compared to more than 34% statewide. How concerning is that?
Well, it's quite concerning. I mean, obviously, and particularly if you have a high demographic group of minorities in a city, that African Americans and Hispanics are much more vulnerable to serious consequences once they get infected. So I would want to see an increase in vaccinations in the city all around, but particularly for minorities who really are at a much greater risk of a serious consequence of hospitalization and even death.
Have you found nationally in urban areas that there's a vaccine hesitancy that you maybe don't see in other areas of the country?
It really varies, but you're right. Often you would see in urban areas that there is that, but I wouldn't really want to designate that as an area that is particularly hesitant. There are multiple reasons for hesitancy, each of which you can counter if you have the opportunity to speak to people and reason with them about why they really do need to take a vaccine.
And messaging efforts are underway here. If necessary, should the city of Detroit consider something like incentives for people to take the vaccine, whether that be tax breaks or something else? I mean, could that work?
That's been considered and that's discussed. I would leave that to the local authorities. There have been some financial incentives where people have actually given money to individuals if they would take the vaccine. I think it's going to be on a local level to make a decision as to what works best for your community.
And maybe let's end on this. Pfizer with some promising results yesterday. Their phase 3 trial with adolescents 12 to 15 years of age, 100% efficacy. That's got to be good news as we continue to move forward and look to vaccinate younger and younger people.
Oh, that's very, very good news. I mean, you're right, it was 100% efficacy. They did a study in 12 to 15-year-olds. There were 18 cases of COVID-19 in the placebo group and 0 in the vaccine group. That really is very good news because you do want to get the children vaccinated, particularly adolescents.
Dr. Fauci, we appreciate your time, the information, the insight, and the work that you have done from the very beginning and will continue to do on behalf of the health of each and every one of us.
Thank you very much for having me. I appreciate it.
Dr. Fauci joining us on 7 Up Front.